The medication that I've decided to further educate the patient on today is albuterol, also known as albuterol sulfate. Brand names would be Ventolin or Proventil or also known as ProAir. This inhaler is used to treat asthma and other lung diseases like COPD that have a tightening of the lung area called the bronchioles. The air that needs to pass through into the lungs, it makes it very difficult, and that's what this medication helps to treat. The method or the way that you would actually take this medication is through inhaling through an inhaler. These medications, either the brand name or just the albuterol sulfate itself, is needed to be in a compact canister that actually becomes aerosolized and you breathe it into the lungs. The reason why it's such a good and effective medication for patients with asthma is because it is a beta-2 agonist. What that actually means is you have something called beta cells within the smooth muscle in the bronchial area. What happens is by inhaling this and it going directly to those receptors, it actually bypasses the other organs that are normally used to process other medications. When you take a dose of the inhaler, whether that be something called a metered dose or a dry powder inhaler, either one of those are calibrated or measured so that you get the exact same dosage every time. Once you have taken that dosage, it is processed about 70% out of your body within 24 hours, and that will leave your body through your urine or when you go to the restroom. When at about 3 days or 72 hours, the rest of that dose of that medication has been excreted, or it has left your body, leaving you essentially with none of the medication still in your system. Some effects that can happen that are kind of common effects that we would consider adverse effects, but not something that is of super concern, is this medication can cause some hand tremors, some body tremors. Some patients say that they are shaky after they take the medication. That is a very common side effect and something that we would definitely want to discuss if that were to happen, but knowing that that is normal, you can just let us know. Also, some other common side effects would be nervousness. It also kind of comes with that shaky feeling after you take the medication. It can also cause a little bit of nausea and some sleeplessness. Some patients do have that side effect. The serious side effects, the ones that I would actually be very concerned with if they were happening to you, would be things like chest pain, very severe headache, that your heart feels like it's pounding very hard, or if you were having trouble swallowing or getting any kind of rash or anything on your body. The metered dose inhalers are approved for children over 4 and for adults of any age. For older patients, it is a concern when we prescribe a medication like albuterol because it can affect the heart in many ways, and older patients are at higher risk for heart type problems and other complications. For children under 4, other options to treat asthma or other kind of lung diseases or issues would be considered. It's basically, the reason why is because it's very difficult to get a child under 4 to be able to use the inhaler device itself. Understanding that this medication is very effective in treating asthma outbreaks or asthma attacks, it is needed to also understand that this is not something that should be used around the clock. This is more for an urgent effect. That is one of the reasons why it is ordered as needed, not every day. If it were to be that the disease process of asthma or COPD was progressing to a point where you were needing to use this more and more frequently, that is also something that I would want to address at that time. This is also when I would open up to any questions, comments, or concerns regarding how the medication would interact with the body, and any questions and concerns about any effects.